Now, next part in a discussion of functional anatomy of oral cavity. Applied anatomy of oral cavity means how structure and functions of oral cavity can be related to various disorders of oral cavity and what are their function, what are their contribution to the normal health of oral cavity. The first disorder which we come across in oral cavity is the dental caries. It's a rampant disorder. It's a rampant, more prevalent, highly prevalent disorder of teeth, hard tissue of oral cavity. So dental caries, if we can define it, we can understand it, is the microbial disorder, or it's a microbial disease, and this disorder involves decomposition or damage of teeth. As a consequence, dental caries can cause pits and cavities in teeth. This contributes to food lodgement in teeth, and this food lodgement, when it occurs, it starts a vicious cycle. More the food lodgement, more the depth of cavitation of a tooth. When a cavitation of a tooth, it reaches the soft tissue of a tooth we call pulp, which contain fibers, cells, nerve fiber, blood vessels. So it irritates the pulp or pulpal tissue, contribute to pulpitis. So this pulpitis is the cause of pain and swelling and abscess formation. And all these symptoms manifest in the form of dental abscess or periodontal abscess. So this is the consequence of having dental caries in teeth. And this diagram depicts this particular upper arch tooth, right side, right quadrant tooth, and this is immediately behind this canine. So it is first premolar. And this first premolar, you can say here, this is the decayed part of tooth, enamel and dentin, and this black portion is the carious lesion. And few additional points I will contribute to. Dental caries, as I said, is a microbial disorder. So what is the causative organism? First causative organism predominantly involved in the pathogenesis of dental caries is the Streptococcus mutans. This is the main causative organism. This organism, this bacteria in oral cavity, it degrades carbohydrates, mainly the glucose, and it produces lactic acid in oral cavity. So it is a acidogenic bacteria. And because of the formation of lactic acid from decomposition of glucose or simpler carbohydrates, the pH of oral cavity goes down. Otherwise, a normal pH of oral cavity is 6.8. So lowering of pH leads to decalcification of enamel and dentin, creating pits and cavitation. Additionally, this bacteria, it polymerizes the glucose and it converts glucose after polymerization into glucan. It's an important glucan is dextran. So what is the effects of this polymer of glucose? Dextran in oral cavity, it sticks to the surfaces of teeth. When it forms a sticky layer over teeth surfaces, This is called pellicle. And bacteria find place on pellicle and it colonizes on the surfaces of teeth, and more harm it can do by acid production. So how we can prevent from dental caries? By maintaining proper oral hygiene, by proper brushing, and by proper elimination of lodged food particles. So we can prevent from dental caries. There are various therapeutical measures are also there, which is beyond the scope of at present, which is beyond this scope. We shall discuss in some other meetings and in other discussion. We shall discuss those part. Let's see another slide. This is the applied yes, this is another application, clinical anatomy, gingivitis and periodontitis. These two disorders we can commonly come across, a physician can come across, a dentist can come across when he examine the oral cavity. What is gingivitis? Gingivitis is the inflammation of gums. It is due to poor oral hygiene. So the inflamed gums are predisposed to bleeding. And what is periodontitis? Periodontitis is the inflammation of periodontium. Periodontium are the tissues which encircle a root of a tooth. Suppose it's a tooth and its root. So the root is surrounded by bone and bone is surrounded by gingiva. So in between root and bone there are fibers. These are fibers. So in periodontitis there is an inflammation around gingiva, the inner surface of socket which holds a tooth or a bone, cementum and periodontal fibers. These are all inflamed. Because of their inflammation, the tooth become mobile. There is a looseness in the tooth, there may be bleeding, there may be pus formation. So these all are the characteristic of periodontitis. As this diagram shows, these are the inflamed gingiva, interdental gingiva. These are highly inflamed, red in color, increase in size. So a mild touch, mechanical touch on these gingivae, either by brushing, either by food, can cause profuse bleeding. And this is a characteristic of gingivitis. This is another important condition affecting the different parts of oral cavity, but here the diagram shows this part affects the dorsal of the tongue. And this is called a thrush or oral candidiasis. It's a fungal infection which can influence, which can affect, which can spread on different parts of oral cavity, predominantly on the dorsal of tongue. It may also affect the buccal surface or inner surface of cheek and labial mucosa. These are the predominant parts which may be affected by this fungal infection. And this oral candidiasis is caused by a fungus which is called Candida albicans. So this fungus in a routine condition in a healthy person is a normal oral commensal. That is, it is friendly to human body. It is also present in alimentary canal and vagina also. Until body immunity is normal, this fungus doesn't find any place for its manifestation, to show clinical manifestation. Whenever the body immunity goes down, maybe because of some chronic disorders, that is uncontrolled diabetes, maybe person suffering from HIV infection, maybe a person who's taking corticosteroids, after organ transplantation, or those who are suffering from chronic osteoarthritis. So these are the few suspected conditions where the body immunity it goes down, and these facultative organisms, these commensals which are otherwise normal to the body, doesn't produce any clinical manifestation, they find an opportunity and they manifest and they exhibit, clinically manifest in terms of this sort of lesion. Here in this diagram, it shows a white or a slight yellowish color, this patch over the dorsal surface of tongue, dorsum of tongue. This we call white patch. And this white patch, when you try and rub it with a soft brush, it can be easily rubbed off, leaving behind a mild bleeding area. So when a white patch in the mouth can be rubbed off, then it is almost sure it is because of fungal infection. It can be differentiated from another white patch or another lesion which appears in a mouth on buccal mucosa, labial mucosa. That is another white patch or white layer which we call leukoplakia. It is also a white patch. We shall discuss in detail in the coming slide. So differentiating point between the two is, if there is a white patch that cannot be easily rubbed off, cannot be easily scraped with a soft brush, then certainly it is a leukoplakia, which is due to hyperkeratinization of the oral epithelium, which cannot be rubbed off. But if it can be easily rubbed off, then it is certainly a fungal infection or thrush. So another two disorders in oral cavity which affects the oral epithelium is due to nutritional deficiency in a body of a person. One is a deficiency of vitamin C. So all of you are well aware. So deficiency of vitamin C, when it manifests in oral cavity, it certainly involves the health of gingiva. The gingiva becomes swollen, inflamed, and can be easily bleed upon mild touching mechanical pressure by brushing or by food. This lead to bleeding, spontaneous bleeding, profuse bleeding. This we call scurvy. As we have discussed earlier, this bleeding tendency is a part of gingivitis. Certainly, as I earlier explained. So gingivitis is the inflammation of gums. If we go deeper into the etiology of gingivitis, gingivitis which is caused by poor oral hygiene, like improper brushing, tobacco chewing, presence of calculus, that is calcified substance around the neck of the teeth, around the gingiva. This is called inflammation of a gum due to poor oral hygiene. So this type of gingivitis is a routine practice whenever you go for oral examination of the patients. But in specific cases, if there is a nutritional deficiency of vitamin C, then again there is a bleeding gum, swollen gums. This is also gingivitis. So gingivitis may be because of poor oral hygiene. It may be because of nutritional deficiency of vitamin C. So if it is due to deficiency of vitamin C, then we characteristically, conventionally, we give a specific name to the disorder that we call scurvy or bleeding gum. Do you know what is the cause of scurvy? It is deficiency of vitamin C. So how vitamin C deficiency induce bleeding gums, can cause scurvy? So there is a mechanism. Vitamin C is a coenzyme for enzyme hydroxylase. So hydroxylase enzyme in human body always acts in presence of vitamin C. So what is the normal physiological role of hydroxylase? As the name hydroxylase, this enzyme brings about the addition of hydroxyl group to two amino acids which are proline and other is lysine. These are converted into hydroxyproline and hydroxylysine. So these two compounds, which are called post-translational modification of proline and lysine. So these two compounds, hydroxyproline and hydroxylysine, are most essential during collagen fiber formation. These two compounds, they provide maturity and strength to collagen fibers. And I hope you have understood this. And if I go further deeper, so then what is the role of collagen fibers and how the collagen fibers are linked with the bleeding disorder? Just again assume, just visualize there is a deficiency of vitamin C. In its absence, hydroxylase would not work. That means proline and lysine will not be converted into their hydroxy compounds, which are essential for collagen maturation. And immature collagen fibers are weak. And all of you know that the collagen fibers are the components of blood vessel wall. Tunica externa, tunica media, tunica intima. These are the fibers which provide strength to capillary and blood vessel. So when collagen fibers are immature and weak due to deficiency of vitamin C, this means the capillaries which provide blood supply to the mucosa, these capillaries, because of immature collagen fibers, these rupture because of a mild mechanical pressure, either by brush or by food during food mastication. So this means vitamin C causes immature collagen fiber, weak collagen fiber, which become part of capillaries and blood vessel supplying blood to gingiva. So mild pressure can rupture these capillaries. This is called increased capillary fragility. That is, capillaries are highly prone to pressure. They rupture, causing bleeding, in which we clinically manifest as scurvy. So I hope you have understood this pathophysiological mechanism. Now let's go into the next slide. Yes, leukoplakia, which we discussed earlier in the previous slide. So here leukoplakia means white patch, leuko means white, plakia means patch, a thin layer. And this is formed due to hyperkeratinization, impaired process of keratinization, excessive keratinization, and it appears white in different areas of the oral cavity. So most probable cause, it can be tobacco chewing. Other causes can be sharp edges of teeth, which repeatedly for multiple times for years constantly which impinge upon oral tissues, maybe gingiva, maybe labial or buccal mucosa, maybe a etiological factor for impaired keratinization, can lead to hyperkeratinization. Let's see in this picture where it is a white patch. This is a buccal mucosa and this area represent white patch. This is leukoplakia. And leukoplakia, it has pre-malignant tendency. That it in itself is not malignant lesion, it in itself is not a cancerous lesion, but it has a tendency that if it is not checked, treated well in time, or its causative factor remain intact, is not discontinued, then it may have in future tendency to go for malignancy, that is carcinoma of oral epithelium. Yes, this is another abnormality disorders affecting oral cavity. This is cleft lip and cleft palate. So cleft lip and cleft palate. So what is cleft lip? Cleft lip mean a split in the lip, either upper lip or lower lip. One thing. Second, split in a lip may be either unilateral or it may be bilateral. That is, if it is in a lower lip split, then the split can be either on the left side, unilateral, when both right and left lower lip areas of the lower lip are involved, then it is bilateral. Third point, the cleft lip, suppose it is there in the upper lip. If it is only confined to the lip, or it may extend to the nasal cavity. So these are the different types of cleft lip. It is a cleft split in a lip, maybe unilateral one side or bilateral, maybe incomplete pertaining to confined to only lip or may extend to nasal cavity. Now this diagram clearly depicts what we have discussed. In the first diagram, there is a cleft split in upper lip. As you can visualize, this cleft or split is present on a upper lip and it is unilateral. And in this diagram, this says unilateral incomplete cleft lip because this cleft is only on a single side of upper lip and this cleft does not involve nasal cavity. So it is incomplete unilateral. So in this diagram, there is a single cleft, single split in upper lip and it involves on the same side, on the left side, it involves a nasal cavity. It involves a left nasal cavity. So this is unilateral and complete. And this diagram says this is bilateral cleft lip and it is complete. Bilateral because it's an upper lip, both the sides are involved and extending to the right and left nostrils, nasal cavities. So this is a complete lip. So what is the cause of cleft lip? Cleft lip most common cause of it is the deficiency of folate or folic acid. When folic acid is not adequately administered to the pregnant lady, pregnant woman, mother during pregnancy, so this cleft lip arises. It is a congenital defect. So mostly cleft lip and palate, it appears to manifest during 12th to 20th week intrauterine life. So the most common cause is folate deficiency. So another probable cause, although there are multiple causes, but I am saying the most prominent cause is the folate deficiency. And another category of prominent cause is the use of anti-epileptic drug by pregnant lady during pregnancy, and the probable drugs are valproic acid. And another probable drug can be as a causative agent in cleft lip and palate is the phenytoin sodium. So these are the prominent causative agents in cleft lip and definitely in a cleft palate. Let's see what the cleft palate means. Cleft palate means a split in a palate affecting either hard palate or soft palate or involving both. Then we call it as complete cleft palate. As the diagram says, this is incomplete cleft palate. Here this diagram, here the cleft is only confined to the hard palate. So when it is in a hard palate, so there is a separation of right and left upper dental arches. So any liquid or edible which we intake, consume, that has a tendency to pass into the nasal cavity, is a constant source of infection in nasal cavity and upper respiratory tract. And furthermore, multiple consequences are here. We can have, a patient can have, and it is highly demoralizing for patient. So in this second diagram, there is a unilateral complete cleft lip and palate. Here, the right nostril involving upper lip on single side, involving hard palate, and it reaches up to the uvula part, certainly involving soft palate. So this diagram is a bilateral complete cleft lip and palate. It's the same thing. It involves both the sides, the right and left side of the upper lip, right and left nostrils, hard palate, and involving soft palate. So let's discuss another disorder affecting oral cavity. This disorder is primarily linked with the salivary glands and their ducts. This is sialolithiasis, a abnormal process of formation of calcified substances, that is stones, that may be either in a salivary gland itself or most probably it occurs in the salivary duct. This is one point we call sialolithiasis. And first point. Second point, which salivary gland or duct is most probably involved? It is, I say, around 80 to 90%. It is always the submandibular salivary gland or its duct that is involved, 80 to 90%. Remaining chances are that it may be the 5 to 10% is maybe the parotid gland or its duct is involved. And regarding sublingual gland and its duct, it's a rare chance that it may be involved with sialolithiasis. So this diagram says this is this typical portion. This is bulged part. This says this stone in duct of submandibular gland. You may be knowing certainly you must be knowing the name of duct of submandibular gland. Let me tell you, the name of the duct of submandibular gland is called Wharton's duct. It's called Wharton's duct, and this diagram shows stone in Wharton's duct. So where Wharton ducts opens up in mouth, Wharton duct from each submandibular gland, like right and left. So Wharton ducts opens at the floor of oral cavity, below oral mucous membrane, on either side of the lingual frenum. This is lingual frenum, and this is the opening of the Wharton ducts belonging to the right side. And this bulged and white portion, this indicate stone in right-sided Wharton's duct. And another condition is mumps. Mumps is a highly infectious disease. It can spread from one person to another person. Mumps can spread from one person to another person by the aerosols, by the droplets containing virus. It may also spread by touching the infected saliva containing virus of an infected person. When one healthy person come in contact with the saliva of an infected person, transmission of the virus take place. What's the name of virus which called mumps? It is called mumps virus. Or its another name is paramyxovirus. So this mumps or paramyxovirus, it may be inhaled by respiratory tract. So then it enters the respiratory organs and tissue, it proliferates. From here it enters into the blood circulation. And from blood circulation, it predominantly harbor parotid gland. In parotid gland, it multiplies, and body's response induce inflammation in parotid gland, which is clinically manifested by pain in the parotid gland area, that is in front of the outer ear, on the side of the face. There is an inflammation, redness. There is a closure of the mouth, which we call trismus. There is difficulty in swallowing. There may be associated with a fever and a rundown condition. These are the symptoms of mumps. So in advanced cases, in severity increases, it may also induce inflammation in testis in male, may induce sterility. It causes orchitis, inflammation of this testis. So third condition in this slide is xerostomia. So word xerostomia, that means zero. Zero refers to dryness and stomia refers to mouth. So it's a clinical condition in which saliva production is reduced or in some cases become totally absent. Mouth become dry, leading to various clinical manifestations. One, while speaking, there are cracks on the labial mucosa, buccal mucosa. There are more chances of fungal infection of tongue and different parts of the mouth. There is bleeding in teeth, inflammation of the surface of tongue, difficulty in swallowing. This is a xerostomia manifestation. What is the cause of xerostomia? Most common cause of xerostomia is exposure to parotid glands when a patient is treated by radiotherapy. This is the most common cause of xerostomia. So there are certain drugs which may also induce xerostomia. Yes, another disorder affecting oral cavity. The last one is oral cancer, which may be caused by multiple reasons are there for oral cancer. One such reason which we discuss, leukoplakia, which can progress to oral cancer or the carcinoma of the stratified squamous epithelium of the oral cavity.